This is Jose Merino, Editor-in-Chief of the Neurology family of journals. The Neurology podcast provides practical information to neurologists and other clinicians to help them provide better care for their patients. Thanks for listening and have a great week.
Hi, this is Farrah Mateen. I'm a neurologist at the Massachusetts General Hospital and co-editor of the Without Borders section of Neurology. This August, the NINDS published a series of 10 papers in a special issue of Neurology. This comprehensive sequence of papers will guide NINDS's health equity efforts over the next 5 to 10 years. Today, I'm pleased to interview Richard Benson, Director of the Office of Global Health and Health Disparities of the National Institute of Neurological Disorders and Stroke, or NINDS. Thank you for joining us today.
Thank you for having me, Farrah.
So my first question is, what exactly is neurologic health equity, and why is it important to the NINDS?
Well, for our health equity strategic planning process, we actually use the Healthy People 2030 definition of health equity. And the Healthy People 2030 definition of health equity is the attainment of the highest level of health for all people. Achieving health equity requires valuing everyone equally, with focused and ongoing societal efforts to address avoidable inequalities, historical and contemporary injustices, and the elimination of health and healthcare disparities. And so we use that definition when we were doing our portfolio analysis, our request for information, and that was sort of the lens that we discussed with our health equity work group that was commissioned by our institute director.
You mentioned 2030 and that the guidance will be for the next 5 to 10 years. In some ways, there's an urgency to do health equity too. So one question is, how soon will we start to see the effects of the strategy? How soon will things be implemented?
Well, we are in the process now. Dr. Walter Korschetz, who's the institute director for the National Institute of Neurological Disorders and Stroke, in 2020, he commissioned a working group of our National Advisory Council to give advice to the NINDS on what we could do to address health equity. Recommendations from that process were published on August 15th in Neurology. However, prior to the publication, we actually started activities implementing some of the things that we found from our group. Some of them are trans NIH. One thing in particular, we have a campaign called the Mind Your Risk campaign, which is a public health campaign that's created through our communications department that's geared towards the highest risk in the United States for stroke and dementia later in life. And so it's geared to African American men who control hypertension from the ages of 28 to 45. And so we started that campaign. We've been doing a lot of activities across the country, partnering with major urban radio stations, academic institutions, and other organizations to implement that public health campaign to get the message out that uncontrolled hypertension is associated with the development of dementia later in life, as well as risk for cardiovascular disease and stroke. And so that's one thing that we've started to implement. The other thing is that we actually, during this process, one of the things that came out is the need for more community engagement or community engaged research, getting community members, particularly those communities that are designated by the NIH to experience health disparity, racial and ethnic minority groups, sexual gender minority groups, low socioeconomic status groups, and people who live in rural areas, to get them involved in clinical research. And so we started something called the HERN Initiative, or the Health Equity Research and Neuroscience Initiative, which we actually have 2 notices of funding opportunities that have been published. So we do have 2 published, I'm going to say NOFOs, or notices of funding opportunities, that have been published related to community engagement. And the other activities that we work with our NIH partners as well. So we've been working with a trans NIH group through the Common Fund. There's a program as well that's looking at community engaged research in multiple areas beyond neurological diseases. But I'm representing the NINDS for the neurological diseases. And we also have something called the Build Up Trust Challenge that's through the National Heart and Lung and Blood Institute that we're also worked on as well, where we're trying to, again, build trust between the community and researchers.
I wanted to ask you about one of the papers in particular, which I found very interesting, and it was the portfolio analysis of health disparities and health equity within the NINDS. And one of the findings of the paper was that within the 5-year time span measured, there were 58 new research projects from the NINDS related to health disparities and or health equity. And based on your strategy, I guess I'm curious what will change in the coming 5 years. And do you anticipate there'll be more targeted approaches to look at this research and to encourage this research?
The information that we got is the information that we received. And so we don't try to sugarcoat anything. What we're hoping to do through this transparent process is to increase the submission of applications as well as the number of funded applications over the next 5 to 10 years in order to boost the types of research that we're doing at the NINDS related to health equity. The other thing is we'd like to move, a lot of those projects were sort of focused on, they were large epidemiologic studies focused on what our institute director calls admiring the problem. We would like to move beyond admiring the problem of disparities and trying to intervene to eliminate health disparities and move towards a state of health equity. So we are looking to see in the future more interventions related to addressing some of the health inequities that are out there. And we would like to move beyond stroke. A lot of the work that we see in neurological disorders in terms of health inequities, we have a lot of data related to stroke, but there are a lot of other neurological disorders where we don't have some of that baseline data. So we would like to get that as well in terms of what are the disparities in some of the other more rare neurological disorders that are out there. So that's what we'd like to see in the next 5 to 10 years.
Many of our listeners are in the clinic and in the hospital practicing neurologists, often general neurologists, and they may see health disparities day in and day out. And I'm wondering how this strategy and plan will potentially affect the practicing neurologist.
Well, what I'd like neurological care providers to consider is that medical care does not take place in a vacuum. It goes beyond the individual and the family member sitting before you. That person and that family has a social context. The medical provider also has a social context. And so that has to be taken into consideration. We can't only focus on seeing the patient. We give a medical plan where we prescribe a certain medication, we suggest physical therapy, and then that's it. We give them the bill and they walk out the door. Do the family members in the family have access to transportation? Do they have safe housing? Are they able to exercise? Can they afford the medication? Was the visit in a language that the patient and family members actually understood? The other thing beyond that is that we know that there are a lot of other factors that impact neurological outcomes or that can cause negative health outcomes beyond the biologics. Some of those things that there are unconscious bias, racism that takes place on the medical side. There's a lot of mistrust that a lot of groups have that has to be addressed, as well as some of the other social determinants of health that are there. And so I think this type of context is very important. The other message I would say, AAN recently did a review of the Axon registry to try to see if there were disparities in how patients are treated on an outpatient basis for neurological disorders based upon the Axon registry. And what they found was that there's a lot of missing race and ethnicity data in that database. And so it's important for medical providers to remember that there's basic information that should be collected if we want to address health equity moving forward. We're not collecting this information to mistreat people or use it in a negative or nefarious manner, but it's important to understand the racial or ethnic context, the region where someone lives, and those other factors. Does a person live in an area where they don't have access to fresh fruits and vegetables?
I wanted to ask about neurologists in training and the sort of future generation of neurologists. I think it's widely known in academic centers that there's an increasing interest among our applicants for neurology residency, and we're in application season again, and they're saying they want to do health equity research. It's important to them as a doctor and as a future neurologist, and often they're discouraged or at least told that that's taking a risk or that that's like an atypical career path. I'm wondering, in terms of the curriculum and building this group of people who really want a career in health equity, if you have any thoughts on those folks.
So we had two of the manuscripts that focused on training. One of the articles focuses on health equity training in general. And the members of that work group feel that health equity should be taught to anyone that's interested in the biomedical sciences, regardless to going to medical school, graduate school, dental school, or any type of research environment. It's important for researchers to understand health disparities, health equities, and that social context that impacts health outcomes. And so that was a health equity training manuscript. And then there's another manuscript that focuses on diversity health equity training as well, increasing the diversity of people doing health equity training. Research has shown that people from diverse backgrounds tend to do research that relates specifically to them. People from various countries, people from various minoritized groups tend to gravitate towards research projects that are relevant to them. And so it's important to have diversity in training because we get more diverse projects there in terms of the types of ideas, types of interventions that are out there. So it's very important in terms of training the next generation so that people understand about health disparities and health equities and those structural barriers such as racism and unconscious bias, because that leads to a workforce that understand those differences. It also leads to people from every or any background that's interested in doing that type of work to understand that context and how to do the work. Now, the question is, I know historically that at the NIH, particularly with the NINDS, that some researchers have thought that, well, the NIH or the NINDS is not interested in funding that type of research. And so I think this dedicated supplement should dispel that myth. Our institute director is very dedicated to the elimination of neurological health disparity. And so he's very interested in funding good research. So sound principles, rigorous research projects related to health inequities. And so we would like for that next generation of researchers as well as seasoned researchers to get the message that the NINDS is interested in eliminating health disparities and moving towards a state of health equity. And we are interested in funding the best research in this area.
Richard, I wanted to ask you a little bit about your own career in neurologic health equity, and if you had any lessons you wanted to share from your career to date.
That's a great question, Farrah. What I would say is that this type of work requires passion, it requires dedication, and it requires tenacity. At the NIH, there are a lot of things that impacts our budget that are out of our control. And so the Institute sometimes has to make hard decisions. And so we have to continue to be advocates for these topics all the time because they are very important. Unfortunately, we may have this topic that's very important and there may be another topic that's also very important. So hard decisions have to be. The other thing is that the attitudes, the beliefs, and behaviors don't change overnight. Unfortunately, it takes time for people to understand, just getting people to understand the difference between health disparities and health equity and what health equity is and why it's important is something that's difficult. And so one of the themes or things that sticks out in my mind is a quote by Dr. Martin Luther King Jr. It's that the arc of the moral universe is long, but it bends towards justice. And so I think if you're working in this field of health equity, that we have to realize that it's going to take a long time, but overall that the moral universe will bend towards justice.
In your case, did you know you wanted to do health equity work before you became a neurologist, or did you become a neurologist and that allowed itself to happen? Or what was the sequence?
Well, I just realized this later in life that I did not plan this at all, but my father was a Baptist minister, of a moderate-sized church in Ohio, where I grew up. And my mother was a social worker who worked for Urban League. And so I'll never forget, as a little kid, my father and mother took me with them to give communion to a lady who had a stroke. And so I remember looking at my father gave communion, and my mother helped the lady in her wheelchair. And I remember sitting there thinking, wow, I wish I could do something to help her. And so that's actually interwoven with who I am. I am a person who's focused on social justice. I'm focused on helping people, and a medical provider. And so that's why I think to do this type of work, that passion has to be there, and the tenacity as well, because it's not easy.
My mother is also a social worker, so maybe we don't give enough credit to our parents and families and our career choices sometimes.
Very important.
My next question is the frameworks. And so the NINDS has actually created instruments for measurement and frameworks and tools, I guess I would say, that can be used to monitor progress, hopefully. And I'm wondering how these instruments and tools are going to be used.
Let me preface by saying that I really hope that listeners will go back and look at the supplement. And I suggest starting with the executive summary. The executive summary actually gives an overview of the whole supplement, and it tells a little bit about each of the manuscripts or articles in the supplement. And it talks about the process that we went through in order to create the supplement. So I would start out by reading the first manuscript, which is the executive summary. I'm really excited about the manuscript that looked at the NINDS health equity framework. And so this is a framework that moves beyond the biologic. Historically, a lot of research focused on biologic factors and how that relates to the development of neurological disease. So in this framework, it contextualizes those other upstream factors that actually impact the individual to lead to neurological disease. We have totally upstream factors, intermediate factors, and then proximal factors, such as structural racism that's there, the structures that are there. And then we have environmental factors in terms of where somebody was raised, the social position in terms of where a person was raised in society, and then moving on to individual behaviors, and then the biologic. And so this particular framework, we'd like for medical providers as well as researchers to look at this and to think about those other factors where we can intervene in order to impact neurological outcomes. And so it's a great manuscript as well. And actually the editors and the people that reviewed that particular manuscript said this should be required reading for anyone interested in doing biomedical research. And so I would suggest reading that article and looking through the framework, but it really moves beyond the biologic factors which lead towards health inequities, as opposed to those other factors that we've talked about.
So I really want to congratulate you on your leadership in this sequence of papers, but in your career in general and all the work you're doing.
Well, thank you, Farrah.
This is Stacey Clardy, your podcast editor. If you've enjoyed the podcast, please take a few moments to subscribe, rate, and review the Neurology podcast through Apple Podcasts, Google Podcasts, Spotify, or wherever you listen. And remember, you can always head to neurology.org/podcast for our full list of past episodes. Or you can also search by keyword in your podcast app for any neurology-specific topics you want to learn about.